Hi, welcome to this video series where we review the clinical judgment model of the NCSPN and actually apply it to NCLEX test questions and a particular case study. This video particularly will focus on number 2 of the test items of the 6 cognitive skills where we analyze the cues. So let's go ahead and move over to the test question so we can actually apply this. Here we have our case scenario. So this is item number 2, and that always pertains to analyzing the cues. This is back in the emergency department where we're caring for the 62-year-old client, and we already analyzed the symptoms that the patient has here according to the history and physical. And just as a quick refresher, this patient had sudden onset of right-sided facial droop 1 hour ago, slurred speech, positive right-sided arm drift, and then also right-sided lower extremity weakness, along with a mildly elevated blood pressure. So now in this analyzing the cues, it goes over the question, which 3 additional assessment findings or diagnostic results are most important to plan care for this client? So we're supposed to pick out 3 here. And as you can see, I've already, again, answered the question. And first of all, we need to recognize that this patient might be having a stroke. But it's always important to analyze a capillary blood glucose level because hypoglycemia can mimic signs and symptoms of a stroke. Most certainly, if we are suspecting that the patient is having a stroke, we need a CT scan of the head stat right away to see if there's any bleeding or if we're dealing with an ischemic stroke. And then number 5 here is a standardized stroke assessment. Now, this is a more detailed stroke test that requires typically more of a specialized training to actually be able to do that. And so here we have analyzed the cues. We have now determined that we're suspecting this patient is having a stroke, and these 3 things are next important for us to do. And keep in mind here that this still goes over assessment also. So we're still kind of like in the assessment phase where we're recognizing the cues, but now we need a little bit more of a detailed assessment on their neurologic system. The very nice thing is with UWorld on the bottom here, you always get explanations of why the correct answers are right and why the other ones are wrong. And it also tells you other things that you might want to click on, signs and symptoms of hypoglycemia, and it applies to the NCSPN client need of physiological adaptation. So thanks for watching this video on test item number 2 for the case study. Please make sure to follow UWorld the Nursing School Explained on YouTube, and then also check back for the next video where we explore the cognitive skill number 3 in this series. Thanks so much for watching. See you soon.